Welcome. Today we're diving into the world of tonsillitis, a common condition that can cause a sore throat and discomfort. We'll explore what it is, why it happens, and how it's treated, providing you with a comprehensive overview to help you understand and manage this ailment. So, what causes tonsillitis? In most cases, it's triggered by viral infections such as the common cold or the flu. However, bacteria, most notably Streptococcus pyogenes, also known as strep throat, can be responsible. Less common causes include other bacteria or even, though rarely, fungal infections. Close contact with someone who is infected increases the likelihood of contracting tonsillitis, especially if the cause is bacterial. Let's talk about what happens in your body when you have tonsillitis. The tonsils, located at the back of your throat, are part of your immune system. Their job is to trap germs entering your body through your mouth and nose. When infected, these tonsils become inflamed and swollen. This inflammation is your body's attempt to fight off the infection, but it's also what leads to the characteristic symptoms of tonsillitis. Tonsillitis is a very common condition, particularly affecting children and adolescents. While anyone can get tonsillitis, it's most prevalent during the school-age years due to the close proximity and sharing of germs among children. Seasonal variations also play a role, with cases often spiking during the colder months when respiratory infections are more common. Now, how can you tell if you have tonsillitis? The most common symptom is a sore throat, which can be quite painful. Other signs and symptoms include difficulty swallowing, red and swollen tonsils, often with white or yellow patches or streaks, fever, headache, Iraq, and swollen lymph nodes in the neck. Children may also experience abdominal pain or vomiting. Diagnosing tonsillitis typically involves a physical examination by a doctor. They'll examine your throat for redness, swelling, and any visible signs of infection. To determine if the cause is bacterial, a throat swab may be taken for a rapid strep test or a throat culture. A rapid strep test provides results within minutes, while a throat culture takes a couple of days but is more accurate. Tonsillitis can be classified into different types. Acute tonsillitis refers to a sudden infection that typically lasts for a few days to 2 weeks. Recurrent tonsillitis is when you experience multiple episodes of tonsillitis in a year. Chronic tonsillitis is a persistent infection of the tonsils, often accompanied by other symptoms like bad breath and persistent sore throat. The treatment for tonsillitis depends on the underlying cause. For viral tonsillitis, treatment focuses on symptom relief with rest, fluids, and over-the-counter pain relievers like acetaminophen or ibuprofen. If the cause is bacterial, antibiotics, typically penicillin or amoxicillin, are prescribed to eradicate the infection. In cases of recurrent or chronic tonsillitis, a tonsillectomy, or surgical removal of the tonsils, may be considered. Pain management after surgery is essential. It's important to complete the entire course of antibiotics, even if you start feeling better, to prevent complications. While you can't completely eliminate the risk of tonsillitis, there are steps you can take to reduce your chances of getting it. Good hygiene practices are crucial, including frequent hand washing, especially after coughing or sneezing. Avoid sharing drinks, food, or utensils with others. When coughing or sneezing, cover your mouth and nose with a tissue or your elbow. Maintaining a healthy immune system through a balanced diet and regular exercise also helps. The prognosis for tonsillitis is generally good. Most cases of acute tonsillitis resolve within a week or 2 with appropriate treatment. However, untreated bacterial tonsillitis can lead to complications such as rheumatic fever or kidney inflammation. Research is ongoing to develop more effective and targeted treatments for tonsillitis, including exploring alternative antibiotics and non-surgical approaches to managing recurrent cases. New studies are also investigating the role of the tonsils in the immune system to better understand when tonsillectomy is truly necessary.